Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important, so we want to answer as many as we can. The first one was about sick sinus syndrome. Is this the same as leakage of the heart from last week? And I just say that it's totally different. And sick sinus syndrome is a very fast rhythm, and then it can go slow, and then it can go fast, and it requires a person who is an expert in rhythm. And a leaky valve sometimes needs to go to heart surgery to replace the valve. But any disagreement? You know all this stuff.
I have no disagreement.
You're an internist.
I just recertified for my internal medicine boards last year, so
there you go.
I agree.
All right, from Redfield, 82-year-old person, blood sugar level of 120 after fasting. Does this indicate borderline blood sugar?
So
diabetes?
So with fasting, a 120 would be impaired fasting glucose. That is in a pre-diabetic range. So yes, I would, and with that number, I'd want to get a hemoglobin A1C and maybe do a few other, testing, because that's starting to get more on the edge towards diabetes.
And certainly the reason we treat people lower now than we used to is because
we know that in terms of preventing the complications.
It's the complications of diabetes,
right.
The vascular disease,
right, exactly.
Strokes,
heart
attacks.
And sometimes it's not just being aggressive with the glucose, but also high blood pressure, what is your cholesterol, other risk factors like smoking, and really intervening in all those.
I like the idea of exercise to help that person, first of all.
Right.
Here's from Sioux Falls, 88-year-old person, always too warm, sleep problems, too small nodes on the thyroid. Could this be problems for sleep? And is there a blood test for thyroid? I mean, what is your clue? Could this be a clue for hyper or hypothyroid?
I would say that the heat intolerance, I'd be worried about hyperthyroidism.
Too high.
Too high, right.
Hyper.
Overactive thyroid, and that could be due to an autoimmune process such as Graves' disease. If they feel like there's nodules in there could be what we call hot nodules. These are not cancerous, but they make too much thyroid hormone. So I would go in and get TSH, a free T4, get some thyroid function tests.
I would say this, though, there are many reasons for night sweats and for sweating at night.
Right.
Low-grade infections, menopause.
Go see your doctor.
This is an 88-year-old person, though. It's probably not menopause. Check your doctor.
Right.
Sioux Falls, 68, can hypoglycemia turn into type 1 or 2 diabetes? Having reactive hypoglycemia, let's talk about what that is.
Right, and so that basically is where you eat something maybe more carbohydrate laden, and then later on you go on and you get shaky and sweaty and you get hypoglycemia.
And you're not on any diabetic
Not
drugs?
on any diabetic medication, but that can often be an early clue, especially for type 2 diabetes, because you have insulin resistance, and so you get this exaggerated response. You get too high of an insulin secretion, and eventually it wears off. And sometimes even years before people become overtly type 2 diabetic, they can have that as a symptom.
Hypoglycemia. So if you were going to do anything, you would have them do all the things you would do to prevent diabetes.
Right.
Check it out.
Yep. Mm-hmm.
And
a lot of times you
have them eat protein or something?
Yeah, do frequent small, what we call mixed meals, where you do more protein, a little bit more fat, maybe even lower on the carbs than you normally would do.
Right. How much influence do drugs, exercise, diet, and/or a combination of the three have? How much influence?
Well, that's a good question. We know that it has influence with preventing those microvascular complications, the eye damage, the kidney damage, the nerve damage. We're not as sure that it really helps in terms of preventing the macrovascular, heart attack and strokes. And in fact, too tight a control sometimes can have a higher concern or a risk. So really, that's where I think diet and exercise are important, keeping the blood pressure, keeping the cholesterol down, and keeping the sugars down through drugs and all that are really important.
If your sugars are running too high and you're not successful with your exercise and diet,
right,
time to go to the meds.
Exactly.
This is a person from Huron. How important is it to find someone who specializes in diabetes, and how can one find a specialist? Is there someone in Huron who could specialize in diabetes? How about an internist or a family physician versus an endocrinologist?
Well,
What's
I
your
think
take?
starting with your primary care physician is a very good place because much of what we can do is really bread and butter, and I think can be handled, by your internist or your family practitioner. But if it's, especially type 1 diabetes, or if they're entertaining an insulin pump, or maybe not having success, or you want to just get more information, there's some great resources. We're very lucky to have wonderful endocrinologists in South Dakota, many in Sioux Falls, both with Avera and with Sanford.
Including you.
I'm happy to, and I'm taking new patients, so
there you go.
we're all happy to see.
Here's the other thought, though. Sometimes what I do, if they're not getting the ideal control, I will have them come and see you.
Right.
And then I'll take them back.
Exactly. We can do a consultation, give you ideas. Sometimes we choose to continue following. The one, as an endocrinologist, I would say the one type of patient in general that I think we should see, if you're a type 1, a true type 1, I really think that should be handled by an endocrinologist.
Yeah. Start with an endocrinologist for sure.
Right.
There's another question that's very similar, talking about Victoza, Bydureon, a urinary tract infection, number of other pills, lost weight and then regained some. When to see the endocrinologist? Does that sound like one?
That sounds pretty complicated, and maybe we've got some ideas that can help.
Here's from Sioux Falls, 62, type 2, for 16 years, hemoglobin A1C less than 6.5. Will I still face the consequences of diabetes? When do you stop? Do we completely control the consequences of diabetes when the sugars are completely controlled?
Probably not, because we're probably not as tight as a non-diabetic. A non-diabetic, it's amazing how tight your sugars are. They're typically between 70 and maybe rarely up to 110 or 120, once in a blue moon up to 50. It's very tight. Even if you're under 6.5, you're probably going to still get some 200s in there. You're going to get some lows. You're going to have more complications, but keeping it in that range, you're significantly reducing your complications. It's estimated for every point you drop that A1C, it's about a 25 to 30% reduction in those complications. So even in that patient going from a 7.5 to a 6.5, assuming they're not having a lot of hypoglycemia, they're protecting against those microvascular complications by at least 25 to 30%.
But that study that came out and looked at the risks dropped when the hemoglobin A1C, somebody who is diabetic, and talking about elderly in particular, that it was.
You start to have increased risk.
The risks go up as you get too low.
Correct.
What does that mean? And does that mean that maybe your hemoglobin A1C needs to be softened as people get older?
I think so. I think in general guidelines are maybe under 7 or under 6.5, but I think you really have to individualize it. And I think even the ADA and the societies are starting to recognize that that's the case.
Husband and friends in the Navy all have symptoms and get diagnosed at the same time. Are there studies in the environmental influences for type 1 diabetes? So husband and friends in the Navy all came down with it at the same time.
That would be an interesting thing. I'm not aware, but it does make you wonder, are there environmental things? In animal models, they will sometimes use toxins to basically wipe out the pancreas, and maybe there was some exposure.
Well, or is it too much chipped beef on toast?
Right. So, hopefully they're working him hard in the military, though. Yeah.
80-year-old caller from Mission, South Dakota is wondering why his blood sugar varies so much after eating the same thing, but at different times of the day.
That's a great question. We all have different degrees of insulin resistance at different times of day. So a lot of times in those morning hours, you're much more insulin resistant. So if you eat that same meal then, it's going to be harder than maybe like at 4 in the afternoon. And so when we have patients and we have them, for example, on insulin, they will take different ratios to what they're eating based upon that time of day.
So it's interesting too that our own body's cortisol changes. Tell us about that.
Right. So cortisol, which is an adrenal gland hormone, a life-necessary hormone that regulates your body, how you actually make sugar, and your whole metabolism works. And a lot of times, cortisol levels will typically be higher in the morning and then lower later in the day. Some people who are on night shifts, that might be flipped, or if you have depression, they may be off too. But depending on when those cortisol rises, your insulin requirements could be very different.
So the very lowest time of a cortisol level is like 2 or 3 in the morning?
Usually Usually late, and then it starts going high in that early morning upon wakening. So usually lower in the evening, midnight or so. We often will, people that were worried about too much cortisol, we do something called a midnight salivary cortisol, because it should be low. If it's not low at that time, that's concerning.
Right. Does that have anything to do with people having heart attacks in the middle of the night?
That's one of the thoughts, that heart attacks and strokes are higher in those early wakening hours, and cortisol could be a component.
65-year-old caller from Whitewood. She says she's a model patient in regulating her type 2 diabetes. She recently had a granuloma on her eye. Is this caused by her diabetes?
I'd have to ask the ophthalmologist. I know that in terms of both retinopathy, which is damage to the back of the eyes, cataracts, and glaucoma can be a higher risk. I don't know about the granuloma.
I don't know about granuloma. I would presume it's an external granuloma from inflammatory whites of the eye being inflamed. I don't know. I don't know the answer either. Yeah. Type 1 or type 2 more dangerous? What is the safe zone for blood glucose levels? So which one is more dangerous?
Well, I mean, type 1 in the sense that if you skip your insulin or miss it, you can get very sick very quickly. Something called diabetic ketoacidosis, which can be life-threatening. If you're even requiring insulin and you're a type 2, you got a little bit more safety factor. But I would have to say, I've had my young, healthy, like triathlete, type 1 diabetics on pumps. I'd rather be in their shoes on, all the insulin than being someone who maybe is type 2, who's had kidney failure, and because their kidneys are making that insulin hang around, they might just be on one pill or nothing. Which one? So I think it really depends on the individual. Yeah.
If you take type 1 diabetes, I've heard that there are two groups of people. One that just does fine. They control things. Everything works perfect. Sort of like our Heidi. Everything is just... And then there are those who just, no matter what they do, everything fails. Their kidneys fail. Everything goes against them.
I think there are other... I mean, we always talk about tight control, but there definitely are other genetic components. Yeah.
Wow. In other words, we don't know everything.
We don't know everything, right.
Here's from Sue Sinner. Is there a correlation between chronic leukemia and diabetes?
Chronic lymphocytic leukemia doesn't come to mind. I don't know if you know, Rick.
I don't, Rich. Yeah. And I mean, one thinks that type 1 is an immuno-driven thing, but I just don't know about leukemia. And I mean,
usually it's like you think of like the Philadelphia chromosome and mutations, and I'm not aware of a link with autoimmune or non-autoimmune diabetes.
Yeah, I mean, the leukemia, I just don't have a link.
More likely, though, if you have leukemia and you go on very high doses of the corticosteroids, you may become diabetic. So sometimes we'll see that as a complication of the treatment for leukemia.
Speak 2 seconds about hemosiderosis, because that is a disease of the liver and can be of the pancreas.
And hemochromatosis. We have
that's what I meant.
Too much iron, and that's what we call sometimes bronze diabetes, where basically you get too much iron in your system and it affects your pancreas. You become diabetic, and especially if you're, let's say, a middle-aged man and you've lost weight and you're not really autoimmune diabetic and there's no immediate other family members, unless you know that they've got iron problems, that could be a cause.
Hemochromatosis.
Yeah.
74-year-old caller. Last question. 74-year-old caller from Delmont. His sister has type 2 on metformin. Her morning sugar is almost 150 before breakfast. She thinks she should be increasing her metformin. What's your thought?
Well, that's a great question. I would
74.
Yeah, and I would probably increase the metformin if she's not maximized on the dose. And many of us feel that somewhere between 2,000 and 2,500 is the maximum dose. So, for example, if she's on 500 milligrams twice a day, I would increase the dose, and I would increase the dose at bedtime. That bedtime one affects that dawn phenomenon, and it'll bring those morning sugars down. So I'll have a lot of patients where if they don't get the diarrhea or some stomach upset, I'll say, take all your metformin before you go to bed. It works best.
Oh,
then.
Really?
Yeah.
So there's some people you just give it once a day?
2,000 milligrams at bedtime.
Really? Mm-hmm. Very interesting. Richard, it's been a great pleasure. Thank you so much for taking your time and coming here and giving your expertise.
Appreciate it.
Wonderful. Thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Until next time, stay healthy out there, people.